Approximately half of the patients I see on a regular basis are men. And one of the most common symptoms of pelvic pain that I see in men is penile pain, specifically pain at the tip of the penis. In the next few minutes, I'll talk about why this occurs and how pelvic floor physical therapy can help. So when men report a burning, shooting, stabbing pain in the shaft or the tip of their penis, that pain is typically due to an irritated nerve. More specifically, that nerve is a branch of the pudendal nerve. It's called the dorsal branch or the penile branch. That branch travels on the dorsum or the underside of the penis and ends at the tip of the penis. So when it becomes irritated, it can cause burning, shooting, or stabbing pain in those areas. When men report more of an achy or sore sensation in their pelvis or in their penis, that leads us to believe there's more of a muscle dysfunction. And those muscles that are either too tight or dysfunctional are creating pain or causing referred pain. So how does that penile branch of the pudendal nerve become irritated? Well, there are several ways. In general, nerves don't like to be compressed or overstretched. So when we talk about the penile branch, which I mentioned, it travels up the underside of the penis and ends at the tip of the penis, it can become overstretched in a number of ways. So first, when a penis becomes erect, it stretches the penile branch. In normal circumstances, this is completely fine. It does not irritate the nerve. However, if a man has a sustained erection for some reason, maybe due to a medication, for erectile dysfunction, or maybe due to priapism, that nerve can become overstretched for a sustained period of time and can become irritated. Another way the penile branch can become irritated is in the gym. Many men that we see incorporate heavy squats into their exercise routines. And when we squat, the pudendal nerve glides over a very small bone in our pelvis. And in some folks, that bone is a little larger than others. It's just an anatomic anomaly. So if a man repetitively squats, especially with heavy weight, that nerve flosses over this bone in the pelvis and can become irritated as a result. Sometimes we see these symptoms as penile pain because the penile branch particularly gets irritated. Another way the penile branch can become irritated from overstretching is with aggressive masturbation or aggressive intercourse. And finally, another way is with aggressive jelqing. Jelqing is a technique to help or to try to lengthen the penis, and when done too aggressively, it can overstretch the penile branch of the pudendal nerve and create penile pain. The other way a nerve can become irritated is by being compressed. Now, the penile branch of the pudendal nerve travels between two muscles of the pelvic floor, and these muscles are superficial pelvic floor muscles, and these particular muscles are intimately involved in sexual functioning. They have to function in order to get an erection, maintain an erection, as well as ejaculating. So this is one of the reasons why ejaculation is often provokes pain, because these muscles have to rapidly contract and relax during ejaculation, and this nerve that is irritated is in between these two muscles. Therefore, orgasm squeezes that irritated penile branch of the pudendal nerve, causing even more pain. So how do these superficial pelvic floor muscles become too tight in the first place? Well, there are a few different ways. If we strain in order to urinate or to have a bowel movement, and we do this day in and day out, those muscles can become too tight because when we strain, we're contracting those muscles. Another way that those muscles can become too tight is by doing unnecessary repetitive Kegels or pelvic floor contractions. Many people believe that doing Kegels or strengthening your pelvic floor will improve things like sexual functioning or sexual performance. Well, they can be overdone. And in this case, if you over-strengthen or over-tighten those muscles, they can put too much pressure or compression on the penile branch of the pudendal nerve, therefore causing penile pain. So how can pelvic floor physical therapists help men that are suffering from pelvic pain, in particular penile pain? Well, as pelvic floor physical therapists, we are specifically trained to treat the pelvic floor muscles and the surrounding structures. So by talking to our patients, we can often figure out what events or activities may have contributed to or triggered their pain. So then with our physical evaluation, we're able to evaluate the muscles, the structures surrounding the muscles, and some of those nerves, such as the pudendal nerve, to see which are contributing to the patient's pain syndrome. After identifying those dysfunctional impairments, we're able to utilize our manual therapy techniques to normalize the muscles and surrounding tissue to create more space for those nerves to become less irritated and painful. We're also able to give suggestions to our patients on how they may be able to modify their activities or their behavior to lessen irritation on those nerves that may be contributing to their pain. And lastly, if necessary, we're able to refer them to other providers that could contribute to their treatment team and provide additional treatment interventions. Pelvic pain is a distressing pain syndrome, and many men suffering often go months or years without being diagnosed or being misdiagnosed. If you're suffering from pelvic pain, there is safe and effective treatment available. Look for a pelvic floor physical therapist in your area and get started on treatment today.